Hello, and welcome to Non-Pharmacologic Options for Veterinary Visit Anxiety, an evidence-based review with Lisa Radosta, DVM, DACVB. I'm Christy Keith, Senior Communications Strategist for Fear-Free. Before I introduce our speaker, I'd like to take care of just a few housekeeping items. First, we'd like to thank our friends and Fear-Free sponsors at Zoetis Pet Care for making this and so many other activities that we've done at Fear-Free this year possible. And we'd also really like to thank all of you for making time for the webinar this evening. We know that your time is very precious and important, and we're very grateful that you chose to share it with us today. Next, yes, RACE CE is available for this webinar, but it is only for those of you who are attending the live webinar. If you are watching the recorded version, unfortunately, there is no CE credit for you. For the live attendees, I will be sending out an email immediately after this presentation, and in it will be a link to the survey you need to take to get RACE CE. Now, please listen to this carefully because it's the #1 reason that people contact me or even fail to get their CE credit. In the final question in the survey, there is a link, so it's in the question itself, to download a CE certificate that you can print out and fill in with your name. However, just because you have that certificate does not mean that your CE credit was processed. You need to complete the survey and submit it, and your contact information needs to be correct. I know sometimes people don't like to use their main or even a real email address, but if you do that, you won't be able to receive your CE credit, even if you have the certificate. So please use accurate information, fill it out completely, submit it. And if you want a printed certificate for any reason, make sure that you print it out because you will not be able to go back. And the survey closes on Tuesday afternoon, after which time I will not be able to help you. So if you have any trouble getting the certificate, please email me at fearfreepets@gmail.com. That's fearfreepets@gmail.com well before Tuesday, preferably tonight or tomorrow, so that I can help you in plenty of time. I'll just mention one other thing about that is that, as I said, it will close Tuesday at 3 Eastern. So please go ahead and take it right away. Even you can take it on your phone. It works that way great. But if you can't print out the certificate on your phone or because you're in a hurry and you want the certificate, just save the link. Just bookmark it or copy and paste it somewhere, and you can go back and download it at any time. You want to save the link to the certificate, not the link to the survey, because once the survey is closed, you can't get in there. I'm sorry if this sounds so complicated. We actually are hoping to have a somewhat more streamlined process for you in 2020, but that is how it is for tonight. Okay, so the other question we're asked is, will this webinar be recorded? Yes, it will. It will be in about a week at fearfreepets.com/webinars. Dr. Radosta should have time for a few questions at the end, but please ask them as soon as they occur to you rather than hoarding them. We all know hoarding is bad. You ask them in the Q&A window, not the chat window, although if you do forget and ask them in the chat window, I will be keeping an eye on that as well. And it's now my pleasure to say housekeeping is over, and I'm going to introduce our presenter. Dr. Lisa Radosta completed a 3-year residency in behavioral medicine at the University of Pennsylvania in 2006 and passed the board examination later that year. During her residency, she was awarded the American College of Veterinary Behaviorist Resident Research Award 2 years in a row. So she is a rock star. In 2005, she went to Baton Rouge, Louisiana to volunteer in the efforts to help animals stranded by Hurricane Katrina. She has owned Florida Veterinary Behavior Service since 2007. Dr. Radosta is an internationally known speaker and co-author of From Fearful to Fear-Free, a positive program to free your dog from anxiety, fears, and phobias. She has written chapters for textbooks, including Handbook of Behavior Problems of the Dog and Cat, and Blackwell's 5-Minute Veterinary Consult, Canine and Feline and Small Animal Pediatrics. She has published numerous scientific research articles, is the section editor for Advances in Small Animal Medicine and Surgery, and serves on the Fear Free Advisory Board and the AHA Behavior Management Task Force. Thank you so much for being with us this evening, Dr. Radosta. Please take it away.
Thanks, Christy. This is one of my favorite lectures. When I was asked to do this lecture, I was given the topic, and I always get excited about research because so much of what we say and do every day is based on our belief system. And it is exciting to come back to our roots and think about what we're really about as veterinarians, as veterinary technicians. And if there are dog training professionals out there, that is even more exciting to me because I want you to be scientists too. So I have a friend who's a very good friend who works with me as a professional on a regular basis. And she asks me frequently when we discuss emotional disorders and dogs especially, because that's the species she works with primarily. She says, well, do you believe? Like she might say, do you believe that Prozac is better than Paxil? And I always say the same thing. I say, it's not about what I believe. It's about what I can prove. And definitely as veterinarians and veterinary technicians and dog training professionals, we do pull from our clinical experience. We do pull from what clients tell us. But at the end of the day, the foundation has got to be the science because it's too easy to become wrapped up in your own reflection. What's reflected back on you is what you believe. And that becomes this kind of horrible, vicious snowball. And then you're really entrenched in your own belief system. So let's just remind ourselves, how can we be good scientists? This doesn't just apply to this hour we spend together, but to our lives really. First, we want to think about findings that are statistically significant. And in this hour we're going to spend together, we are not going to talk about trends, and we're not talking about my clinical experience unless you ask me about it when we're done going through these slides. We're going to talk about the data that has gone through statistical rigor and what those findings are. We're also going to consider the study methodology. So in other words, let's look at how the studies were designed, because you can get a statistically significant result and then have it be a study that's so poorly designed that that result doesn't really mean anything. How can we ourselves practice science? First, we want to be empirical. We want to think about and consider only what we see, smell, hear, or touch. Next, we want to be rational. We want to practice rationalism, logical reasoning, really, really important. We want to be skeptics. I have a friend who is a questioner. No matter what I say, she says the opposite. But what about this? She's a skeptic. We want to be skeptics so that we can be really good scientists and not believe everything that is served to us on a silver platter. We want to have a lack of bias. So I love Rottweilers. I know that breed so well, and I make lots of statements about Rottweilers because I feel like I have some street cred, man. I've lived with them for 25 years. I had aggressive ones, I had friendly ones. But when you talk about science recommendations you are making to clients, I've got to let go of my bias toward that breed that I love. And I've got to be scientific. When we look at studies, we're looking at studies that are peer-reviewed. This is a big deal because I'm going to use thyroid disease as an example. So there's a lot of controversy about thyroid disease in dogs. And there is actual peer-reviewed literature. That means there's a study that was presented to a group of my peers. There's a study that was presented to people I don't even know. They read through it without ever seeing it before, and they reviewed it and sent it back to me and said, hey, you know what? You really didn't do this well. You need to change these things. That's peer review. On the other side of the thyroid issue, hypothyroidism in dogs, there's a lot of case reports. There's a lot of anecdotal evidence, right? That's not peer reviewed. We want things that are peer reviewed. Good science is repeatable. That means that you can do that study, repeat that study again and again. And then we want it to be valid. We want it to be measuring the actual thing that we're trying to prove. All right. So we know now how to be good scientists. Now we're going to start to take a look at actual products. Okay. Number one, let me just tell you where we are. We are going to look at a slide like this as like a placeholder. Think of it as the beginning of a chapter. Okay. You'll see there'll be a picture of whatever device or item or product we're talking about. Then in the lower right-hand corner, if you can see my cursor there, you'll see there's an emoticon. And that emoticon is the summary of the research. So you can look directly at this slide and know exactly what's going to happen. That is Princess. She's wearing a thunder shirt. At each junction, each chapter heading, let's call it, you are going to see the name of the product, and you're going to see that emoticon, that thoughtful emoticon in this case. And that emoticon means that I'm not so sure that this product is worth using. The jury is definitely out, but it's not getting a thumbs up. Scroll down to the next slide, Christy, if you would. And you're going to see from that slide, guys, that the study that I've told you about now twice, right? And that study, there it is. And you won't see my pretty builds and all the little fancy schmancy stuff I did, but you got the point there. You've got 16 pet dogs, all hospitalized, anxiety prior to ThunderShirt placement. ThunderShirt is placed. An hour later, they're going to measure that anxiety score with the same tool that they used to measure the baseline, okay? Anxiety scores were significantly lower in all dogs. Wow, except for one, right? So 14 of 16 dogs, the anxiety score was lower. One did not have a lower anxiety score, statistically significant, and one died. Okay, that kind of stinks. So what the researchers seem to feel, and this is from, and when I saw the original kind of abstract, they were implying that they felt that the ThunderShirt had been applied too tightly. Okay, so what I told you earlier was what that skepticism that we have to always have. There's no control group. And I don't know if I put 16 dogs in an ICU for an hour and a half, if 14 of them would be calmer, one wouldn't, and one would be dead. So this study has that little glitch in it that makes us a little bit careful with the results. So now we'll scroll to our next slide, which is the conclusions. So each time that you see me present a study, you are going to see me draw a conclusion. So you can get it like in a nutshell. When applied properly, the ThunderShirt can reduce anxiety in hospitalized patients. When applied too tightly, it can contribute to mortality. So not benign, which until I read this study years ago when it first came out, I thought the ThunderShirt was fairly benign, but it really isn't. Next slide. In this study that you'll see at the very next slide, there's 90 pet dogs. And these 90 pet dogs have either separation anxiety or they have generalized anxiety. They're split into these three groups. And I personally think the study design on this was very good because they really looked at all of the different ways that this particular product could be used. Group 1, ThunderShirt placed correctly. Group 2, ThunderShirt placed as an owner might place it. A little loose, okay? Group 3, no ThunderShirt. So all of these animals have disease process. They're all anxious. They're split up into three groups. ThunderShirt's placed correctly. Treatment, let's call it, applied incorrectly. No treatment, that's control. They measure a baseline heart rate and they look at the body language. They put these dogs in a kennel for 15 minutes. They measure the maximum heart rate and they do another body language analysis at the end of this time period. Next slide, Christy, please. Let's look at the results. Group 1 had a smaller heart rate increase from baseline than the other two groups. So if you apply a ThunderShirt correctly, the dog's heart rate will not go up as much, will not be as much of a difference between baseline and maximum. There was no difference in maximum heart rate. Okay, no change between any of the groups. Group 1 had the lowest maximum heart rate when compared to group 3. So there was a statistical significance between group 1 and group 3, but look at that. Oh, you can't see my cursor. I want to point to it. That was only when they took all the dogs on anti-anxiety meds out of group 3. So when they have dogs that are on anti-anxiety meds, there was no statistically significant difference. Another statistically significant difference from the body language analysis was that group 3, no thundershirt, okay, face the kennel door more than group 2 or group 1. What's the implication? Dog's looking for the owner. Dog's more stressed. I think that is probably a leap, but that is the implication. So let's go to conclusions. That's the next slide. When you apply a thundershirt properly, and this is the big thing, right? With this particular device, you have to apply it properly. When you apply it as directed, the thundershirt can reduce the maximum heart rate in stressed dogs with generalized, you're at the right one, that's perfect.
I know,
Generalized
sorry.
anxiety, separation anxiety. But look at this last line. It is most effective in those dogs who are not on any anti-anxiety medications. Where are those dogs? Really? Most of the dogs in your clinic, in my clinic for sure, because all I see is dogs with problems. But a lot of dogs in your clinic are on supplements or medications and also thundershirts. So let's go to our big conclusion slide. Take it away, Christy Keith. There we go. Here's my conclusion. There's some evidence to support the use of this product to alleviate anxiety and stress in dogs. The effect is mild. We're seeing that. And it's less apparent in those pets on medication. That kind of stinks because we like to use as many modalities as we can. It may increase morbidity in critically ill patients to whom it's applied incorrectly. And that's kind of scary. Okay, moving on to the next slide, where we're going to talk about through a dog's ear and through a cat's ear and iCalm dog and iCalm cat. These are basically the same product. You know, you can buy this iCalm dog and iCalm cat as a MP4 player. Through a dog's ear, it probably still comes as CDs. So these are all the same products. We're going to go to the next slide, and we're going to deviate a little bit because there isn't any research on through a cat's ear specifically that's peer-reviewed. What we do know is classical music. What does that do? We do know that. So this is a study done on 12 pet cats, owned cats, that are all at the veterinary hospital for elective OHE, okay? And during anesthesia, the cats wore little tiny headphones. They wore little tiny noise canceling headphones over their little tiny precious ears. And they listened to 2 minutes of classical, 2 minutes of pop, and 2 minutes of heavy metal at 3 different points in the surgery, okay? Like the points would be, for example, where the ligature placement and transection of the uterine body was. That would be a point. Or ligature placement and transection of the ovarian pedicle. That's a point, right? So they measured those, and they measured heart rate and pupillary dilation. Let's move on to the next slide. Dun, dun, dun. This is the punchline. Oh, Christy, come, there it is. Guess what? Kitties like classical music. Is that the most precious thing? There were statistically significant differences at all points between classical music, pop music, and heavy metal music. And kitty cats like classical music. They had lowest of the 3 heart rate and pupillary dilation. Come on. That's a cool study. I would love to see a picture. That cat is not from the study. I would love to see a picture of the cats in that study. Okay, so let's move on to the next slide. That's our little conclusion slide where you see the star, you see the conclusions. Classical music in the OR can reduce autonomic nervous system activity and allow for reduced anesthetic dosages. I'm in love with that, but I don't know how many surgeons are out there, but you know, I've worked at a specialty hospital, with the exception of 3 years of my 19 years of being a veterinarian, I've worked at a specialty hospital. And the surgeons seem to universally universally like heavy metal. Like this one surgeon I worked with during my internship, I could hear it from well outside the OR. Like he was slamming it on the heavy metal like all night. So now when I think back on that, I think, wow, we really should have been playing classical music, right? Okay, let's move on to the next one. In this one, we're looking at species-specific music. Again, this is not a branded product, but you need to know about this stuff because you need to know the difference between what the branded product might be claiming and what we actually know, right? These are 47 pet kitty cats, and they are tested at home with their mom and dad present, mom or dad or both present. They are played 3 minutes of cat-specific music. All right, so here's the thing. What is cat-specific music? It's music that is of the tone and of the frequency of cat vocalizations. That's basically how they're defining it here in a nutshell. It's deeper than that, but that's the basic idea. So when kitties were played this music versus when they were played straight up classical music, the researchers found a difference between the cat's orientation and approach and the amount of time it took for the cat to approach. So in other words, if you play cat music, kitties will approach you more. They'll approach you more quickly than they would with just classical music. Okay, next slide. Okay, so that's basically what I just told you. Species-specific music is preferred by kitties. Moving on.
And my dog just weighed in that she also prefers.
We're going to get to the music for her in a second. All right. So this is our big conclusion slide. Oh, we had to give it a thumbs down. Well, there's no evidence to support the specific music that is branded, that is played through the iCalm cat speaker. Although classical music reduces autonomic nervous system arousal, cats are more interested in cat-specific music. I think that, in my opinion, although I gave this a thumbs down because I'm just reading the evidence now, I just think this needs to be studied better because this product may work. Because we know classical music works. So this product may work. We need some studies. Moving on to the next slide. Through a Dog's Ear, iCalm Dog. This one has 74 pet dogs. Again, I think this is a well-designed study. It got published in JAVMA. You know, that's an accomplishment. It's a really nice journal. So I think it's a well-designed study. 74 pet dogs. These dogs go to the vet's office. And during their examination, they're going to hear one of three things. They're going to hear Through a Dog's Ear, or they're going to hear classical music, or they're going to hear no music at all. Then the owner and the doctor completed a survey. So you see what's being measured there in yellow, the survey, and the heart rate and the body temperature of the animal during the physical exam. Okay, let's see what they found out because maybe these dogs were super calm. Let's go. Uh-oh. There was no difference in anxiety, mean heart rate, mean body temperature, owner assessment, or veterinary assessment between the three groups. To remind you, the groups are Through a Dog's Ear, classical music, no music. However, owners who heard classical music reported higher satisfaction rates. And you might be giggling, but as a practice owner, I kind of take that seriously. If they're going to be happier, that's good. They might be calmer. There's lots of research to show, well, at least 2 studies that show that calm owners who are touching their pets produce easier to handle pets on the exam table. So although this product doesn't seem to have any use based on this study, if it makes owners happy, classical music makes owners happy, that is valuable to the pet and valuable to us. So let's go through to the next slide, our big conclusion slide. That's where you see the star. Through a Dog's Ear does not reduce client, veterinarian, or dog stress during an examination in a veterinary clinic. But let's see, are there any more studies? There is. Let's go to the next one. This is 117 kenneled dogs, okay? And these dogs are given 4 treatments. Again, I think this is another well-designed study personally. 4 treatments: through a dog's ear, classical music, heavy metal, no music. There's 45 minutes of music, and then you get 15 minutes of whatever ambient sound, which in a kennel is going to be dogs barking and crying usually, sounds of dogs, jumping up. So you get 45 minutes of whatever the treatment is, 15 minutes of nada, not silence, ambient sound. All the dogs were exposed to all the treatments over 4 months. So dogs are acting as their own controls basically for this study. And what they're measuring are behavioral observations. And let's see what they found out. Dogs respond to classical music just like I do. They sleep more. So if you expose a dog to classical music, it sleeps more than dogs exposed to through a dog's ear, heavy metal, or no music. Heavy metal music caused increased shaking, just as an aside. Okay. So what this tells us is that through a dog's ear, yet again, in these 2 studies that we've looked at, and you can go to the next slide, Christy. In these 2 studies that we've looked at, we are seeing no difference between classical music and through a dog's ear. It does not reduce stress in kennel dogs, according to this study. And then we'll go to our big conclusion slide, which will have the thumbs down, unfortunately, that there's little to no evidence to support the use of through a dog's ear to reduce anxiety and stress in dogs. But what did we learn? We learned that classical music works on dogs, works on cats. That's perfect. Thank you, Christy. To go to the next one. You're doing it perfectly. You and I are like zen right now. That's it. So classical music works on dogs, cats, and owners, right? So classical music should be playing in your clinic for sure, I think. All right, pheromones. You're getting giant thumbs up on the pheromones. And you're going to talk to different people and everybody's got an opinion on everything, right? But let's look at some of the research. Let's advance to our next slide. I want you to know, I don't care if you're a primary care practitioner, veterinary behaviorist, dermatologist, surgeon, the most studied product in veterinary medicine is pheromone analogs. I would take an hour to present to you just the adaptive evidence alone. Don't get me wrong. I'm not saying every study shows it works, because that's not true, right? But I want you to know that what I'm showing you here, unlike what I did for Thundershirt or I Calm Dog or I Calm Cat, where it might be like all the studies, this is just like tip of the iceberg, okay? All right. Tim doesn't like my voice.
It's not Tim, it's Stella, my greyhound. And I apologize. Normally I'm on mute and I'm not now because of the problems we've been having. So I really apologize to everyone for her.
It's okay. It's okay. I think you can mute yourself. Christy, I think you can mute yourself and we'll be okay.
Well, I can no longer see the controls.
Oh, don't do it. Don't mess yourself up. I don't mind hearing a dog. And I'm actually shocked that my cat has not entered this room yet, because he does not like webinars without his presence. So we'll see. We still have a couple more minutes for him to come in and start wailing. Okay. So moving on to this. Look at all these great vets. I think we're used to these sounds. Hi, puppy. Are we an awesome group of professionals or what?
We are.
We're pretty freaking cool, I have to say. Really. All right, moving on. Back to this science stuff. Moving away from the warm and fuzzy stuff. Okay. This is just the beginning of the research. I can't present it all to you. There's too much. So I took a little bit of kind of everything. What I want you to get from this is that most of these studies do have a control group, unlike the Feliway studies we're going to see in a minute. And that Adaptil has been looked at for virtually everything, for storms, for shelter dogs who bark, for shelter dogs to reduce stress, dogs who are riding in cars. It's been compared to clomipramine, which is Clomicalm. It has been looked at in puppies to see if they're more social, they play more, less fearful. So I'm not going to go through all of these studies because we don't have 3 hours, and I want you to ask questions, frankly. So we're going to go to the next one. This is my summary. Yes, check mark, thumbs up for noise aversion. That's like a newfangled word for noise phobia, noise fear, kind of rolled into one thing. And that does encompass to some extent storm fear. If you're a behavior nerd like Krista, Dr. Sirois, our third-year resident, or Karen Ashby that's on this, then you're separating those out and you're saying storm phobia isn't noise phobia. You're right, but noise phobia is a part of that storm phobia. So noise aversion, social isolation in puppies, so helping puppies be more social, yes on that. Stress and hospitalized dogs, yes, you should be using it in the hospital. Separation anxiety, yes. Fear of fireworks, which is noise aversion, yes. Puppy training and socialization. So in other words, affecting the socialization process in a positive way and showing that puppies who are trained under the influence of Adaptil are more likely to learn those tricks that you're teaching or behaviors that you're teaching, be less fearful, more likely to play, and it's effective in shelters. But look at the nose, perioperative stress. So I just told you to use it in the hospital, but it doesn't look like it's so effective for the kind of maybe intense, I'll call it, stress that comes with separation from your parents and getting ready for surgery and post-op. Kennel stress, but you see in the yes, I put shelters, and in the no, I put kennel stress. And that's the nature of science. Studies have to be repeatable. So what I'm telling you is that in one study where Adaptil was used, dogs were calmer and happier when in a kennel in a shelter situation. And in another study, that's not the case. And that is the nature of science. And that's why things must be repeatable and repeated before we can believe it to be true. Okay, we're moving on now to our big conclusion slide. There's a thumbs up on this. There is good evidence that Adaptil can alleviate stress in dogs in a variety of situations, and that does include the veterinary office. I want to say this, really like deviate from my scientific talk for like 60 seconds. Please, when you use anything that I'm talking about here or any sort of non-medicine treatment, manage your own expectations and the client's expectations. So I recently had a client come back and say that a certain supplement that I had prescribed for her that her dog had been on was didn't work. But when I questioned her more, I was like, what do you mean it doesn't work? Like, what does that mean? And she said, well, he still barked at the front door. And I said, well, did he bark as much? And she's like, no, he didn't bark as much. And I was like, then it worked, like, hello. So worked means 25% change for anything that is in this hour we spend together. Anything. If it's not a medicine, I'm expecting a 25% change. And I'm going to tell the people in my exam room, day one, this is what I'm expecting from this. So then when they come back to me and I say, well, how much of a change? They say, oh, I think it's 25%. I'm like, good. We're going to keep using that. And now we'll add on this other thing too. Okay. So thumbs up on Adaptil. The next slide is Feliway. Feliway, we are giving a thumbs up as well. Although I think you will be less floored by the design of the studies. So let's move it forward, Christy. Let's see what the studies look like. The studies were really focused on the cat problem, which is urinating in the house, okay? There is one study here looking at hospitalization, but for the most part, we're looking at urine marking. For the most part, these are owned cats. Some of these studies do have a placebo. Some of these studies don't, okay? So that's a kind of a challenge. Like if you go to the last studies, that's your last row, 36 owned urine marking cats, right? The owner uses Feliway spray. 91.6%, that should say, of the cats, so basically all the cats pretty much, had a greater than or equal to 50% reduction in urine marking by week 4. Think about that. The owner has to use it for 4 weeks, and she may get a 50% change or more. So already you are managing exactly what the owner should expect. You must use it for at least a month. If you get 50% or more, you're lucky, you're probably going to get 25 to 50%. Because if I look above that, 1, 2 above it. So it's the 1, 2, 3, 4th, I guess, row across. You can see those cats, 22 owned urine marking cats. There was a significant difference in marking in Feliway cats versus placebo cats. Okay, so that's great, but only 20% resolved. So if your owner is thinking this is a binary question, marking versus no marking, you are going to fail every time because only 20% of the animals are going to resolve based on this one study if it's a binary answer. Okay. I want to look at the animals who are sick because this is about the vet hospital. I'll go back 2 seconds. I'm sorry, Christian. You're so in tune with me, and I just took a deep breath and I just got caught up. 2 things. Number 1, in the Griffith study, that's the second one down, we have 20 owned cats, 7 healthy, 13 ill. Basically what happened is that these researchers sprayed a towel with Feliway, or they sprayed a towel with vehicle. That's the stuff that makes the Feliway kind of evaporate. The vehicle kind of evaporates off, makes it come out of the spray bottle, right? Okay. The cats who were exposed to Feliway ate more and groomed more. I just felt that was big because cats don't groom. They lie in their litter boxes or in the corner in a little meatloaf puddle, and they don't eat anything. And so we want them to urinate. We want them to defecate. We can't get them to take anything in. So that kind of was significant to me. That was important to me. And then the second one from the bottom, the Gunn et al., these were FIC cats. And they were looking for a difference in these cats who had chronic FIC, if they could see a difference between Feliway spray and placebo. And there was no difference. Even though we know, like from the studies that were done at UC Davis and the stuff that Tony Buffington has done, we know for sure that stress is a huge part of FIC. This product was not effective in a placebo-controlled study for reducing recurrence or clinical signs of FIC. All right, now we're moving on. So this is my yes and no's. The yeses, stress at veterinary visits. Yeah, let's do that. Just use it for that. Stress associated with reactivation of feline herpes virus 1. Yes, that has been studied. So if you're in a shelter, if I got any shelter people out there, plug those Feliway diffusers in. Urine marking, we got a yes on that, although we don't have 100% resolution, but nothing's going to do that for you. And we have an increase in food intake in cats who are hospitalized. Look at this, we got a no on handling. So I'm already saying to myself, Feliway might not work for aggression, because there's one study that says if there's intercat aggression in the household and there's urine marking, then you are less likely to see an effect from Feliway on the urine marking. So now I have 2 different situations where I have cats presented with urine marking, but the cats who are aggressive, or the cats who are aggressive or have intercat aggression in the household do not respond as well. Now we have Feliway multicat, which is made for that purpose pretty much. So we might get a better result from that product, but this study was done on the old product. All right, we'll go forward. And here's my thumbs up. There's good evidence that Feliway can help alleviate stress in cats in a variety of situations. And now we're going to move on to this beautiful field of lavender. That is beautiful. Let's look at lavender. Let's go to the next slide. 32 owned dogs. All of the dogs have known anxiety in the car. Everybody. They're going to take them on 6 car rides. 3 of those car rides are going to be, look, dude, sweat it out. I'm not giving you anything. Let's get a baseline on your behavior. Okay. Then they're going to take 3 car rides where they're going to be exposed to this lavender scent, right? What did they find out? Dogs treated with lavender spent more time resting and sitting and less time moving and vocalizing. Wow, that's pretty cool. Let's go to the next slide. So what can we conclude? Lavender reduces stress in dogs with travel phobia. Okay, that's easy. That's cheap. It's harmless. I love that. We're moving on. Let's look at it though in a different situation. These are kenneled dogs. They're rescue dogs. So they're kenneled in a shelter style situation. Okay, the treatments are control. I love it when there's a control. Lavender, chamomile, peppermint, and rosemary 4 hours a day for 5 days. Okay, that's how these animals were treated. 4 hours a day for 5 days. And they make behavioral observations. The dog's exposed to lavender and chamomile. These are almost always aerosolized products, and they don't list in the studies the exact product that they used. Although if you pull the studies, because at the bottom of each of these slides is the study, you could probably write to the, not probably, you can write to the author and get that information for sure. Okay, so lavender and chamomile. These dogs spent more time resting and less time moving, which is what I want in shelter dogs, frankly. I want them to be nice and calm. Moving on. Lavender and chamomile reduce stress and rescue dogs who are kenneled. And I want to stop for a second because I want you to see, I don't know if any of you guys have been to my spay and neuter lecture that I gave through Vet Girl, but we did the same exact thing. And I want you to see how narrow my conclusion is. I don't even know if lavender and chamomile reduce stress in pet animals who are boarding at your boarding facility. What I know from this study is that lavender and chamomile reduce stress in rescue dogs who are kenneled. And that's a different animal. Anybody who's worked in shelters or in rescue knows that you are dealing with a different situation than an owned animal. If an owned animal stress is 50% less, would this have any effect? I have no idea. For travel phobia, we have evidence, but not for being locked in a kennel. So just keep that in your mind. Your conclusions have to be narrow if you're going to be a scientist. Let's move on to the next one. Oh, this is our next slide. That's so good because we get to have questions. Yep, so there is good evidence that lavender reduces stress in dogs who are kenneled or have travel phobia. And our final conclusion slide. Conclusions. This is our kind of summary. Feliway adaptal classical music, species typical music. Now that we just know about that in cats. I don't have a species typical music for dogs that's been studied. Chamomile and lavender can be useful in reducing stress. The thunder shirt, I calm cat, I calm dog, and through a dog's ear are unlikely to cause a significant difference in stress in our companion animals. So what I'm hoping is that you will make a foundation of science when you make your recommendations to your clients. Not that you won't listen to them, because I do listen to them, and if they say something works, I always investigate it, right? But that you will have a foundation of science when you make those recommendations. So now I turn it back over to Christy Keith.
Yay, thank you so much. And the reason I unshared was so that I could open the Q&A. I'm sorry, you're probably looking at, I don't know what you guys see when it's
we just see a screen that says join audio, invite others. It's just a happy little screen with a faceless man.
So sorry. So I am going to go ahead and look at the questions. Some of them, normally the kinds of things I would have been answering during the presentation, that can they download a PDF of the webinar. A couple things. One, there will be a recording that will be edited, so we'll at least take out some of the challenges we face, but not all of them, because we want to preserve the wonderful, amusing time we had too. But Dr. Radosta, is it okay that we make the PDF available to people, or did you prefer not to do that?
No, I think we should, because the only reason I don't is if I don't have permission to share a picture, but I think the only picture here is Princess, and I have permission to share every other picture. I've given credit for where I got it, or I got it from the manufacturer. So I think we're okay. Yeah.
Terrific. So,
but you'll take the notes out and make it look pretty, right? I'll do that. I'll send you a nice one. I'll send you a nice one. Okay.
That sounds great. So yeah, that would be a good idea. So we will, normally we don't do this, but I think we'll send this out to all attendees when the recording is available. I will include a link to the PDF as well at that time for everybody. So it'll probably take a little bit longer than the usual week, simply because there's going to have to be some editing done to it. So now that we have done that question, there were also a couple of questions about the studies that subsequently Dr. Radosta mentioned that you would need to contact the person who did the study to find out. Are the scents, do you know, were those essential oils in the lavender?
The lavender ones. So those, I believe, I'm scrolling through to see if I have in my notes. Those, I believe, were essential oils. But if you want to know the brand, you just have to go to the bottom of the slide. You'll see the citation, because you're going to get this sent to you, and you can email the author. You should be able to do that without the complete citation. You should be able to do that from the abstract. So you go on PubMed Plus or Google Scholar and contact the corresponding author. And if you can't, like if you're like, it won't let me do it, contact Christy and she'll contact me, and I'll just pull a study off my hard drive and we'll figure out how to get that author's name.
Yes, you can just email me again at fearfreepets@gmail.com. That is our email address where we handle webinar business. So, okay, so we got a number of people asking. I'm going to say that I saw this question coming. Are you aware of any studies about the effects of
CBD? Is it CBD?
Yes, ma'am.
Oh, yeah, right. Of course, there's no studies on CBD. No, there's not. Here's the thing. I wish we should patch Dr. Sirois on. We get asked about this. My doctors and I do. It has to be every day. It has to be every day. So number one, no studies. CSU is looking at CBD is my understanding. My understanding is that that they have toxic levels already done and that they're looking for arthritis and epilepsy. So I think that information is going to come to us. We do not have it right now. There is no indication. There's no literature. Let me be specific, right? Oh, from Krista saying multiple times a day for sure. So there's no literature to support using CBD at all for anxiety disorders, for fear-based disorders, for panic disorders. So there's the science. Should I share my opinion or no?
Yes, please. Go ahead.
Here's my opinion. I would not in 1 billion years give my child, and my dog is a child too, so my human or dog child, something in a brown bottle that some guy made in his garage that the FDA has not looked at. And my child and my dog are my most beloved, and my husband are my most beloved people in my life. If I wouldn't give it to them, I would never give it to a patient. We don't know what's in the bottle. We don't know if it's pure. We don't know if it's formulated like they say, and we don't even know if it works. And I know people are down on meds. Like, I get that. I don't want to put my dog on Prozac or Xanax. Like, I hear that, and I understand it. I really hear it in my heart. But here's the problem. The problem is that, oh no, Dr. Sirois called out that I didn't mention that I love my cat. I do love him. I do. I love him, Krista. Oh no. So anyway, so the thing is that people are down on meds. They're scared of meds. But let me tell you something. I know what meds do. I could pull as many studies on Prozac in animals as there are, and I could pull a billion studies, that's an exaggeration, but a lot of studies on Prozac in people, on Paxil, on Effexor. I know what it does at least. Somebody's accountable for what's in that tablet. So I don't understand the big deal with CBD, and there's no evidence in humans or in animals to support its use in anxiety, in fear, and in phobia.
Great, thank you. Here's an interesting question. Do you think that the studies on thunder shirts rule out the possibility of learned helplessness contributing to some dogs seeming less anxious? Is heart rate enough to go on?
That's such a good question. And I think, so I think, you know, I wonder more in cats than I do in dogs. I don't think that the studies rule out learned helplessness as a factor with a thunder shirt working. The truth is, I'm going to sound like I'm down on the product, and I don't want to sound that way because I want to stick to what, you know, we're the facts today, but the product doesn't work enough for me to feel like learned helplessness is a situation. But I do want to stop for a second and just define what it is, because there's maybe some people here who don't know what it is. It's going to be a situation where the animal is in a behavioral situation where the animal doesn't know how to get out of the situation. There's a persistent failure to succeed at getting out, okay? And there's a sense of powerlessness. It can happen from a traumatic event. It can happen from a sudden event. It can happen from learning, like being shocked again and again and again and not understanding how to escape the shock, and the animal curls up into a ball and stops trying. That's learned helplessness. Okay, so that could be happening with thunder shirts. My impression is that it's not, because they don't seem to work that well. They don't seem to cause that effect. Dogs walk into the clinic with them on, and they don't seem at all inhibited with them on, when I see them at least. However, in order to really answer your question, we would have to do a study. And I don't think, and I'm sure that hasn't been done. So I think I applaud you for having your eyes and ears open and looking for those things that look like the average person, like calm, but are really pathology. So I would push you to keep your eyes and ears open, because that may be happening in dogs. And I bet you anything it's happening in cats.
Any study or info or studies, research that you're aware of about sound machines, white noise machines, ocean waves, etc.?
Yeah, we use white noise in our clinic, and we recommend the white noise or brown noise or pink noise or just something like that for storm phobic dogs. But there's no study that calms dogs, that specific waves or the rain sounds that would definitely put me to sleep, calm dogs. It would be nice to have a good study on that.
Have you heard any research or anything in the pipeline about using the Assisi Loop for anxiety? I've been seeing some things on that.
You mean the separation anxiety?
Yes.
Study that came out of NC State?
I think so, yeah.
Yeah, so there is one study, right, that came out of NC State that was presented to us, VBS, in July. And I believe that is what that's what you're talking about. Mm-hmm. So if I can recall the study, what Margaret Gruen did was the owners did have to use that product every single day. And we are trying to get our hands on those, because they're giving them, they were giving out samples. It was at a reduced price. And so there is one study that showed a change in the animal's level of anxiety. It wasn't overwhelming, and the owner had to be there to apply the product. It's not something they put on a dog and they left.
Right.
So there's a lot of commitment there. That doesn't mean you don't recommend it. It's just there's a lot of commitment. And the actual brand name, you're going to hear some rustling. I have the actual brand name of the product right here. It's called Calmer Canine. And you can learn about it from Assisi Animal Health. It's assisianimalhealth.com/Calmer Canine. What else? Yeah, the Assisi Loop. That's it. Mm-hmm.
Yep. Sorry, I was just letting someone know what it was.
Oh.
Because if you haven't really seen, when someone says Assisi Loop and you don't know that it's like the city of Assisi, I guess you don't even know what it is. Hearing.
Oh, I didn't know that. Yeah. I'm not very cultured. Is that a city somewhere? I'm going to have to look it up.
It's the city St. Francis of Assisi in Assisi.
Assisi. Oh, God, I do sound like I'm not cultured. All right, moving on.
That's okay.
It looks like
the
halo. For the blind dogs, it looks like the halo. Instead of being horizontal, it's vertical on the back of their neck. That's what it looks like.
Okay, here's a good question. Very practical. When dealing with a dog with extreme anxiety in the clinic who requires gabapentin and trazodone for exams and grooming, do you think any of these products will help?
Yeah, so the answer to that is yes. And you got to manage your expectations. If you're giving this dog trazodone and gabapentin, then he's got to be a pretty anxious dog. And so I might get a 10% change if I had pheromones in my clinic, pheromone analogs, to be clear, in my clinic. Maybe I'll get a 10 or 15% change, right? But that's something. Even if it allows me to reduce my meds a little, that's still something, considering that most dogs are groomed every 1 to 3 months. So he's getting sedated a lot. So yes, worth doing. I have to manage my expectations. And I have to say, Dr. Sirois, again, who's one of our third-year residents, she and I have been discussing a grooming case she has. And I've never owned a dog who had to be groomed. All of my dogs are like, throw them in the pool, they swim around, they dig a hole, they get back in the pool, they're clean. So I watched videos of her patient being groomed, you know, at her request. She wanted to see what's going on. I can't even imagine. I mean, it looked so uncomfortable. The slicker brush, the dog's hair being pulled and pulled and pulled. And this was I'm not going to use the term because it's a branded term, but she was supposed to be a groomer who knew how to do things in a kind way. And I don't think she was being mean. I think that is the way she grooms. And that's the way probably most groomers groom. And so, because you mentioned had to be sedated for grooming, in my mind, I always wonder, how often does that dog have to be groomed? What is the grooming like? Can we change the way the dog is groomed so that he doesn't need so much of any of this, whether it's Adaptil or gabapentin or trazodone? And I know I'm talking too much, Christy, but I'll tell you this one story. So there's so many really great veterinarians in Southeast Florida, like so good. And they ask us to come to their clinics and do fear-free stuff. And we go out for free and do that. So I'm there at this really cool clinic in Delray one day. And the groomer comes out with this little Yorkie and this nylon muzzle. You know, he's like, I'm going to challenge that little 5-foot-tall squirt that's in the lobby giving a lecture. And he's like, I got to trim this dog's nails, yada, yada, yada. And this dog's going to blah, blah, blah. And I'm like, okay, well, let's see what we got. So of course, by then, because the doctor is completely on board and the technicians are, so we all sit on the floor with this Yorkie and we try to figure out, what will you eat? What are you afraid of? What we figured out he was afraid of was the restraint. Not the clipper, not me holding his foot, but it was someone holding his little body. And by that time he was panting, he was drooling. And so I said to the groomer, I said, well, I think what we should do is send this dog home without a nail trim and Dr. Jones will prescribe some meds. And the groomer said, no, I'm not doing that. Because, and I understand his point, this lady bought a package. She bought a package. This is his business. He's going to send that dog half done. But the doctor said no. And this was a biggie for those of you that run practices. He said, no, we are going to send the dog home with meds. And I said, can we try with some roast beef? Right? And he's like, yeah, we got some roast beef from the sandwiches we had for your lecture. So we started with roast beef, no muzzle, got all the toenails done. The lady came to pick her dog up. Vet came out, was like, hey man, this dog's totally stressed out. Your dog needs some meds. I happened to be standing there. We did a little lobby consult. Dog went home, all was well. And I guess my point is, this is a good groomer. He's a nice guy. He didn't know better. And if you're having to sedate, maybe just go and talk to that groomer too. Like maybe there's something we can do on that end as well to lower your meds doses, you know, just a thought.
Great. I had a question, and I'm going to go ahead and ask, since I feel like I've earned it tonight. As you know, I have a dog with severe thunderstorm phobia, and I took your class on that, which was incredibly helpful to us.
Thank you. Dog Nerds. Dog Nerds. .thinkific.com. That's our course.
Yes, not a commercial thing here. I signed up, I paid, no freebies. It really helped my dog.
Yeah.
But one of the things that I wanted to mention is that I believe that he's making an association with the music, with feeling better from all the other things we're doing. A lot of people are asking about combining things for a cumulative effect, and you referenced that a little bit too, but is some of that not so much a cumulative effect as association? Like I give him Cilio, put him in his sanctuary room, and I'm playing the music. Do those things together make him associate the music with feeling better?
Right. So yes to everything that you said. So yes to using multiple modalities at the same time. And so if I'm afraid of storms, I'm a dog, and I'm afraid of storms, and you use music and Cilio in a safe room and massage, let's just say, to calm me down, and I experience the thunder, right? And I'm calmer. Now the association with the thunder becomes different, but also now I know what saved me, what pulled me out of the depths of despair. It's hard for me to wrap my head around the Cilio because I'm a dog, but I could wrap my head around the syringe that you brought out to give it to me. I could definitely associate that when the music comes on, I'm going to get that syringe. In about 20 minutes, I'm going to feel better.
Mm-hmm.
Right? So absolutely that those associations, yes, they happen for sure. And I have a little tiny Papillon patient that we use Cilio for the vet. This dog had chronic diarrhea from like 6 months on. The vet could not examine it without the dog trying to bite her, and such a good vet, again, down in Boca Raton, amazing veterinarian. And she's like, I need this blood work. I want a GI panel on your dog, but I'm going to turn him into a hot mess if I hold him down. So we used Cilio for 2 or 3 visits. And I think one of the keys was that he was a drop off, and he stayed with her and her team, and they were all very sweet to him. Now and this is like 6 months, 12 months later, he goes to the vet, no drugs, because he was calmer and he was able to receive this doctor's like care and attention, as opposed to letting him freak out and then trying to give him some injectable med. His mom brought him in really calm. He stayed with the doctor and her team. That association is entirely different now, which, no pitch for Cilio, but that is one of the things Cilio does, is it allows the dog to be ambulatory and calm, but to learn and form new associations. I love that drug.
Me too. We would not, I don't know, I probably would have had to move my dog to somewhere where it doesn't thunderstorm, if not for it. But we are talking about non-pharmacological solutions tonight, so we'll stick with that. So lots and lots and lots of questions about music. And one of them is, could there be a difference in the music if the animal hears a type of music at home a lot? For example, if she listens to heavy metal and your animals relate to it as being what they are normal at home, would they not find it calming elsewhere?
Yeah, that is absolutely true. And this is one of the reasons why my team wears purple or red scrubs. Those are 2 of my favorite colors. Orange is probably my favorite color, but God, we couldn't wear orange in the clinic because that would make everybody's eyes burn. But that's why they wear those scrubs, and I don't worry too much about color. And that's because, just as what you are saying, it's true that the thing that is present when you feel better is the thing that you are conditioned to respond to with calm emotional state. And if that thing is reggae, as was the case with one of my thunderstorm phobic patients, and her dad said, we listen to reggae all the time in the house. And when I put it on, honestly, she goes and lies down in her bed. I'm like, do it, man. You don't have to stick with what I told you if you got something that works better. And so, yes, you are correct. Any stimulus can be a conditioned stimulus, and any emotional response can be elicited by any stimulus, as long as the conditioning was present.
Great. So, and here, Dr. Sirwa will also like this question. Can you state what was the cat-specific music again? Is there a brand on the market that you recommend? And are you ready? Would this be appropriate to play at kitty kindergarten?
Well,
yes.
Kitten kindergarten, it would be appropriate to play at kitten kindergarten. There is no doubt. Tony Buffington was, and I have Krista, Dr. Cyril, I have that disc somewhere in my office, was circulating this cat-specific music and asking for feedback on it. And the question is it branded? And I'm looking back, and it is not, to my knowledge, branded. Because I actually looked back through that study 2 more times because I kept thinking, this must be Icom Cat, and it was not.
Yeah.
No,
oh, really? Interesting.
Yeah, so the study is, let me just look and see if I can find, I'm looking at it. No, so the study is the one from Snowden et al., Applied Animal Behavior Science, 2015, and I would email the author.
Okay. So here's another question, or we've actually had multiple questions asking about what classical music is playing, and one attendee commented specifically that all classical music isn't created equal, that the William Tell Overture is not going to be calming and other classical music would
Yeah.
be. So
Yeah. I mean, of course, I mean, classical music can be as different as, Diana Ross and Pearl Jam, right? It could be anything. But these studies did not say we played this, I don't know anything about classical music, we played this particular frame. They didn't say that. You can find that out, of course, by emailing the authors. But in these studies, they don't tell you every single thing they did. They just said classical music. And for the cats, they said cat music and examples of human music, right? So they didn't really say what exactly the human music was, except that it was classical. You can get that information from the corresponding author. I would bet, but now this is a belief and not science, that the music is relatively soft without a lot of sharp tones, but I don't actually know that to be true.
Okay, we have a number of questions that we didn't get to. I've gone over now because we got a slow start. I'm just going to ask a couple more that are representative. I'm sorry if we didn't get to your exact question. Many questions about combining pheromones with chamomile and lavender. Many people ask this one.
Yeah, you can combine pheromones with chamomile and lavender. You can plug a Feliway diffuser in the same room where there's an adaptal diffuser. Yes, you can combine all of those things. The only time I worry about anything aerosolized is with avian species.
Right. Okay, good. Okay, and a lot of questions, people asking about rescue remedy. Are there any studies?
Yeah, so there's no evidence that rescue remedy works at all. And most of my clients have come in already trying it. There are definitely clients who say they have seen an effect from it. And my sample, if you're being a good scientist already, you're typing in the chat, but your sample's biased. And of course it is. I have clients like Christy Keith who would turn the world over before they let their dog suffer, who would pay anything. Not every client will pay anything, but they will go to the end of the world and try anything they can to help their pet. And I'm dealing with the worst of the worst. So of course I do have a bias sample.
Okay, so Soliquin, Composure, Zilkene, RC Calm Diet. Any research on any of those things that you're aware of?
There's research on Royal Canin Calm. Yes, definitely. Anytime you're going to get a diet from a major food company, a scientific food company, there's going to be a study. So yes, there are studies on the Calm diet. Soliquin does not have a study, but the ingredients have a study. That product previously was a product that was marketed for storm phobia. The magnolia and philodendron were marketed for storm phobia, and there are 2 very tiny studies looking at noise aversion with those ingredients. So not that product, but those ingredients. L-theanine is in Soliquin, and that has been studied out the wazoo. It's got plenty of studies showing positive and no effect, depending on what you're studying. Zilkene is alpha-casozepine. Alpha-casozepine does have several studies that show that it's effective in relieving anxiety. And Composure. Composure Pro has L-theanine. It also has in it several other ingredients that I don't suspect do anything. So if you're just looking at the L-theanine in Composure Pro, then yes, it does have research behind that ingredient. So the only company that's put forth money to study their particular product that's a supplement, I'd say probably is Verbac with Angstitane that I can access right now in my mind. So Soliquin, the ingredients have been studied, but the product hasn't been studied. It's a little different. It's a little distinction, right? And Composure Pro, one of the ingredients has been studied. And Zilkene, again, the ingredient, it's only got one ingredient in it, so that's kind of easy.
Yeah, it seems like it covers it pretty well.
Yeah.
Okay, so we have 3 questions left. So I'm just gonna, do a lightning round here. Any studies on the use of massage?
On the use of massage, not that I came across. I'm kind of surprised actually that I didn't find anything, but not that I came across that look at massage or T-touch. You know, whether or not that works is going to depend greatly on the dog. You know, I'm not a hugger. I don't want to be touched. And if someone tries to massage me when I'm upset, that doesn't make me happy. I want to be left alone. But yet I have a friend who hugs everybody constantly. So it's going to depend very much on the dog's predispositions, I would imagine. But no, haven't found any studies.
Okay. Can you use lavender on cats, and is there any evidence it's helpful?
No evidence in its use in environments where cats are. I want to be careful about on cats. I don't want to put anything on anybody. So I'm not putting any of the essential oils on these animals. They're in diffusers or in sprays or in roll-ons that we might roll on ourselves or a cat bed or something like that. No evidence in cats. No, dogs.
Okay, and here's the last question, and it was reflective of many, many questions like it. Are there any studies out there that look at these supplements, medications, and other interventions in combination?
Like, well, there's studies definitely that look at medications in combination with each other.
Yeah, they did
Yes.
ask about medications, but I think what they're asking is, for example, pheromones plus thundershirt, or white noise, or calming species-specific music plus pheromones, or anything like that.
Yeah, no, I think that would be interesting. I think that would be quite a big study because I need a lot of groups. You need a pheromone group, a thundershirt group, and then a combo group and a control group. Like you need a pretty big N to study all those different groups.
Mm-hmm, mm-hmm. Okay. Well, we are at the end. If your question didn't get answered, I tried to get everyone or all the similar questions. We apologize. Thank you so much for your patience with our technical difficulties earlier. We hope that you got a lot out of this presentation, and I will just restate, the recording will probably be available in a little bit more than a week because of the editing we're going to do. I will do an email to everyone who attended with a link to the recording, the PDF, and that will come as soon as the recording goes live. And in addition, within the next 30 minutes or so, I'm going to be sending everyone who attended an email with the information on your CE, which you've definitely earned tonight. Thank you so much, Dr. Radosta. It was amazing.
Thanks, Christy. Thank you to everyone. Thanks for your patience.
Good night, everyone. Good night, Dr. Radosta.